So now I'll discuss about sympathetic nervous system. Sympathetic nervous system has two receptor, that is alpha receptor and beta receptor. So according to which, now we'll discuss alpha in detail. Alpha is subdivided into alpha 1 and alpha 2. Alpha 2, alpha 1 is GQ type excitatory, while alpha 1 is GQ type, alpha 2 is GI type. GQ type of GPCR activates an enzyme which is phospholipase and increases IP3 DAG level, while GI decreases cyclic enzyme inhibits adenine cyclase, which reduces cyclic AMP. While all the beta receptors are GS type, GS it activates adenyl cyclase and increases CMP activity. Now, alpha and beta receptor both are G protein color coupled receptor. This A scientist by the name Alquist divided alpha and beta receptor. Now, we'll discuss about alpha receptors. Alpha receptors are divided into alpha 1 and alpha 2 receptors. Okay, so alpha receptor alpha 1A is present in iris, which causes mydriasis because of contraction of radial muscle, while 1B receptor present on blood vessel causes contraction of blood vessel, which leads to vasoconstriction and increases blood pressure. Alpha 1A also acts on internal urethral sphincter, so urine does not pass through it because of internal urethral sphincter contraction. Now we'll discuss about alpha 2A. 2A is subdivided into three parts: 2A, B, C. A releases norepinephrine, which acts on postsynaptic organ. Okay. Then this alpha 2A is an autoreceptor, means it automatically controls the secretion of norepinephrine. Alpha 2A is inhibitory receptor stimulated by norepinephrine and inhibits own release, so it is autoreceptors. Okay. There is a drug known as cilnidipine which stimulates alpha 2A receptors, okay, and reduces sympathetic discharge. Then we have alpha 2B receptor. They work like alpha 1 receptor, that is in iris and intraurethral sphincter and blood vessel. It causes vasoconstriction. Alpha 2C receptors are present in pancreas or decreases insulin release, present in platelets. It decreases the attachment. So basically 2C decreases insulin release and decreases platelets attachment. Now we'll discuss about beta receptors. Okay, so beta receptors are divided into three parts: beta 1, beta 2, beta 3. Beta 1 is present in S heart on areas like SA node, AV node, and myocardium. On these nodes, it has positive chronotropic effect, then positive dromotropism and inotropism. Chronotropism is increasing heart rate, dromo is increases conduction, D for dromo, D for conduction, and inotropism is force of contraction. On kidney, it is present on JG cell, that is juxtaglomerular cell, which causes renin release, and because of renin release, it increases blood pressure in the body. Now beta 2 receptor. Beta 2 receptors are present in three areas, that is skeletal muscle, which leads to tremors. On blood, it leads to glycogenolysis and leads to hyperglycemia, because in flight and fright situation you need glucose, so hyperglycemia occurs in this case. Now on smooth muscle, it causes relaxation, bronchodilation by relaxing bronchus, vasodilatation by relaxing smooth muscles of the blood vessels, and relaxation of uterus, that is tocolytic effect, and constipation also occurs in this case. Beta 2 agonists such as salbutamol in asthma causes bronchodilation. Okay, then last receptor is beta 3 receptor, which is present in adipose tissue and bladder. On bladder, there is detrusor muscle. In adipose tissue, it leads to lipolysis. Bladder has both beta 2 and beta 3 receptors. Beta 2 and beta 3 receptor causes relaxation of detrusor muscle, thus decreasing sense of urination. Thank you so much.